Let's talk about the labor epidural. The epidural, in my opinion, is the best way to manage pain during labor. The epidural is extremely safe, and it's, for the most part, very effective in that it will completely take your pain away if it's working properly. The epidural is also very safe. None of it gets in your blood system, so it doesn't affect the baby, and none of the medicine from the epidural will get into the baby's blood system, so you don't have to worry about that either. People ask me all the time when I tell them, oh, it's totally safe, they kind of look at me funny, and I at least share with them, look, I've got 3 kids. My wife had an epidural for all 3 of our kids. Plus, I had some foot surgery a while back, and they used an epidural on me for the foot surgery. So I obviously feel comfortable enough for the epidural to allow my wife to have it and to have it personally myself. I can't think of a better way to let you know that, in my opinion, it's very safe. There are a lot of myths about the epidural. Probably the biggest one is that people are worried that they're going to become paralyzed from an epidural. Well, that's basically nonsense. People do not become paralyzed from an epidural. There is an incredibly unlikely rare complication that theoretically could make you paralyzed, but you're much more likely to get struck by lightning than you are for that to happen to you. In fact, I don't know of any patient, nor do I have any friends that know of any true patients that have really been paralyzed from an epidural. So even though that's a common fear, it's really an irrational fear. It absolutely doesn't happen. So what is an epidural? Basically, it's medicine that's put in your back outside of the spinal cord, but around the area where the nerves come out, so that when those nerves come out, they get bathed in numbing medicine, and it makes you all numb. It's placed by putting a needle in your back, and then a small plastic catheter, like a teeny IV tubing, is placed through that needle, and the needle is removed. So you aren't going to have the needle in your back for more than 30 seconds to a minute. And then you have this little plastic catheter in which we can drip medicine, and so we can keep the epidural running as long as you need it. If you need more pain medicine, we can increase the rate or give you what's called a bolus or an extra amount of pain medicine, and we can keep you comfortable that way. The epidural, once we stop it, will wear off in a half an hour to an hour, sometimes a little bit longer depending on how dense the epidural is. What you'll feel with an epidural is nothing basically from here down. It'll make you completely numb. Your chest, your arms, your face, your head will all feel normal. You'll be able to breathe normally and talk and think normally. You just won't have any pain from here down. It will make your legs a little weak. It'll be hard to move them. And so for that reason, you really need to be in bed once you get the epidural. You also won't be able to get up to go to the bathroom, so we put a little tube in your bladder called a catheter so that you don't have to worry about peeing. That doesn't hurt going in because you have the epidural, and so it's really very comfortable. So the epidural is safe, it's very effective, it doesn't affect the baby, and it really makes labor a pleasure. And so in my opinion, that's definitely the way to go. Now, do I force my patients to have an epidural? Of course not. If somebody wants to deliver naturally or wants to use IV pain medicine instead, that's certainly appropriate. But it's something to think about. One last thing about the epidural. Some people say that the epidural increases the length of labor. My answer to that is, well, so what? As long as you're not hurting, who cares if it takes an extra hour? The truth is, it probably doesn't. When they do the studies, if you think about it logically, if you're destined for a very quick labor, you're less likely to ever get the epidural. If you're destined for a long, drawn-out, protracted labor, even if you weren't going in it thinking you wanted the epidural, you're going to get worn down from the pain, and eventually you're going to take the epidural. And so people that have epidurals are more likely to have long labors, but that's probably why they have the epidural in the first place. It's probably not the epidural that's causing that. So keep your mind open. By all means, get the epidural if you want it. I think you'll be happy. It certainly makes, you can certainly get through labor without pain medicine, but instead of something that you get through, it's something that you can be comfortable and enjoy and really have a delightful time having the birth of your baby, which should be a really special time for you.